COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to place your microphone on mute until I invite you to speak or to ask your question. To view the city official who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we'll be hearing remarks from Dr. Brent Malachny, Associate Medical Officer of Health, Médecin-chef adjoint de la santé publique, and Dr. Andrew Wilmore, Champlain Health Region Incident Commander, Chef des interventions d'urgence en santé de Champlain. Also on the call, we have Dr. Doug Manuel, Senior Scientist with the Clinical Epidemiology Program at the Ottawa Hospital Research Institute, clinicien principal pour le programme d'épidémiologie clinique à l'Institut de recherche de l'hôpital d'Ottawa, who can respond to questions about modeling. After we hear from Dr. Malachny and Dr. Wilmore, we'll take questions from the media. We'll be going by alphabetical order by media outlet. Each outlet may ask one question and one follow-up. At this time, I invite Dr. Malachny to say a few words.
Thanking everyone. Good afternoon. I want to begin by thanking everyone for their continued diligence in practicing physical distancing over this past holiday weekend. Many of you canceled family gatherings, opting instead to connect via telephone or video chats. We know this is not easy, but is vitally important in our continued efforts as a community to flatten the curve of COVID-19. Je veux remercier tout le monde pour votre diligence continue à pratiquer la distanciation physique pendant ce week-end de fête. Beaucoup d'entre vous avez annulé les réunions de famille, optant plutôt de vous joindre à vos proches par téléphone ou vidéo chats. Nous savons que ce n'est pas facile, mais c'est d'une importance vitale dans nos efforts continus en tant que communauté pour aplatir la courbe de la COVID-19. On the other hand, we are hearing about people looking for what I'll refer to as loopholes in the rules around physical distancing. People are asking, can I have a beer with my neighbors if we sit 6 feet apart? Or can I visit my friend's house if we stay outside and keep a distance of 6 feet or more? Be it in your driveway or in your yard, our main message is stay home. We are in the middle of a pandemic, and so only make essential trips outside the home and limit your contacts to members of your household. These measures, along with proper hand hygiene and coughing and sneezing etiquette, are the best way to limit your own risks of becoming ill, and they are the best way to slow the spread of illness in our community. Last week, Dr. Etches talked about efforts to expand testing for COVID-19, and we have now received clarification from the Ontario Ministry of Health with respect to expanded testing criteria for residents and staff of long-term care and retirement homes, for hospital inpatients, as well as frontline workers. At the same time, local laboratories are working hard to increase their capacity for analyzing COVID-19 test swabs and for delivering timely test results. All of this is good news, and as Dr. Etches mentioned last week, continuing to expand access to testing is important into the future to enable more targeted strategies and the eventual gradual relaxation of current restrictions. Now for today's numbers. So as of 4 p.m. yesterday, Ottawa Public Health is investigating 619 lab-confirmed cases of COVID-19 in the community and 15 ongoing outbreaks in institutions. 2 institutional outbreaks having been resolved. Overall, there's 33 new confirmed cases since yesterday, and we also now have 217 resolved cases. There are currently 42 people in hospital, and 16 of them are in ICU. Sadly, 12 people have died. Of these individuals, 11 were over the age of 65 years, and 1 was 45 to 64 years old, 7 males and 5 females. Depuis 16 heures hier, Santé publique Ottawa enquête sur 619 cas confirmés en laboratoire dans notre communauté et 15 éclosion continue dans des institutions. Cela représente 33 nouveaux cas depuis hier et nous avons maintenant 217 cas résolus. Il y a présentement 42 personnes à l'hôpital et 16 d'entre eux sont en soins intensifs. Malheureusement, 12 personnes sont décédées. Parmi eux, 11 avaient plus de 65 ans et un était âgé de 45 à 64 ans, 7 hommes et 5 femmes. Last week at Council, Dr. Etches referenced an ECOS survey on Ottawa residents' views about COVID-19. I'm happy to report that details of the survey and survey results will be posted to our website today. As a reminder, this survey showed that 84% of people have changed their social behavior in response to COVID-19 by only socializing using remote connections. These actions make a difference in planking the curve, and I wish to thank these residents for following public health guidance on physical distancing. Before I turn it over to Dr. Wilmore, I would like to touch on one last important topic. We know that for some, home is not a safe place. I am pleased to share with you that Crime Prevention Ottawa, the Ottawa Coalition to End Violence Against Women, Interval House of Ottawa, and the Eastern Ottawa Resource Centre have teamed up to launch a new initiative called Unsafe at Home Ottawa, a text and online chat tool that allows victims and survivors of domestic violence and abuse to get help and support. The service was created for those who may find it impossible to reach out by calling a crisis line when trapped at home with their abuser due to the ongoing COVID-19 pandemic and physical distancing measures. Ottawa Public Health will be promoting these new resources through our social media platforms, so please look for those tweets and Facebook posts and help us amplify these messages. Nous savons que pour certains, le foyer n'est pas un lieu sécuritaire. Je suis heureux de vous informer que Prévention de crime Ottawa, la Coalition d'Ottawa pour mettre fin à la violence faite aux femmes, Interval House of Ottawa et le Centre de ressources de l'Est d'Ottawa ont collaboré pour lancer une nouvelle initiative appelée Pas bien chez soi à Ottawa. Un outil de discussion en ligne et par texte qui permet aux victimes et aux survivants de violences et d'abus domestiques d'obtenir de l'aide et du soutien. Santé publique fera la promotion de ces nouvelles ressources par le biais de nos plateformes des médias sociaux. Nous vous invitons à partager nos gazeteurs et nos messages Facebook pour nous aider à amplifier ces messages. Thank you again for all your actions you're taking as a community. These actions matter. There would be more cases of COVID-19 in our community had everyone not done their part over the past month. We continue to encourage residents to visit ottawapublichealth.ca/coronavirus for the latest updates and for guidance on how they can protect themselves and their family. On continue à encourager les gens de visiter santépubliqueottawa.ca/coronavirus pour les dernières informations et les ressources pertinentes. Thank you.
Thank you very much, Dr. Malakny. At this time, I'd like to hand the floor over to Dr. Wilmore to say a few words.
Thank you. With both care clinics now open in the east and west ends of the city, pressure continues to be relieved from local emergency departments to manage the COVID-19 pandemic. So far, over 400 people have been seen at the care clinics. Treatment has included chest x-rays and in a handful of cases, transport to hospital. This model provides a high standard of care in a venue that is not an emergency department, protecting the ED for resources for patients requiring hospital-level care. Les deux cliniques sont étant maintenant ouvertes à l'est et l'ouest de la ville et la pression sur les services d'urgence locaux est allégée, ce qui permet de concentrer à gérer la pandémie de COVID-19. Jusqu'à présent, plus de 400 personnes ont visité les cliniques de soins. Ce modèle offre d'ailleurs des soins de haute qualité dans un lieu qui n'est pas un service d'urgence, protégeant ainsi les ressources des urgences pour les patients nécessitant des soins hospitaliers. We've also seen over 7,300 people at the Brewer Arena testing center. There are a handful of assessment centers within the region as well, such as Hawkesbury and Winchester, which are also swabbing. While we are all encouraged to practice physical distancing and to limit the spread of COVID-19, which may mean staying at home for most people, as Dr. Malakny mentioned, we understand that for some, home is not always a safe place. I want to remind the public that the Ottawa Hospital's Sexual Assault and Partner Abuse Care Program, which is run out of the Civic Campus Emergency Department, is still here to care for patients who have experienced sexual or intimate partner violence. If you are in need of care, please visit the emergency department or call the program at 613-798-5555, extension 13770. As always, if you are in need of urgent medical attention, please go to your nearest emergency department or call 911. We are ready and able to help for anyone in need. Thank you.
Thank you very much, Dr. Wilmore. I'll quickly do a roll call to see who we have on the line in terms of media. If I miss anyone, please let me know. Je vais confirmer les noms des médias qui sont en attente. So we'll just do a quick roll call. 104.7 Outaouais, 1310, CBC, CTV, Le Droit, Orleans Star, Ottawa Citizen, Radio-Canada, Rogers, TFO, TVA, and your community voice. We'll just quickly unmute the line just to see if anyone was missed on that list.
It's not mandatory.
Did I miss anyone on that list? So I'm not hearing that I missed anyone on that list, so we'll get started in alphabetical order, starting with 104.7 Outaouais.
Je crois qu'il a quitté.
Oh, vas-y avec la question. 104.7 Outaouais.
Oui, notre question, c'est est-ce que vous pouvez expliquer la situation à l'hôpital Montfort et comment vous faites pour mener?
Peux-tu, s'il vous plaît, répéter la question?
Notre question, c'est savoir la situation à l'hôpital Montfort et comment vous menez l'enquête présente.
On a des difficultés technologiques avec les questions, mais je comprends que les questions est de donner plus de détails avec la situation avec l'hôpital Montfort et comment la situation est menée. Je crois que c'est une question pour Dr. Wilmore.
Pardon, je n'ai pas entendu la question complètement. C'est quelle situation est-ce que vous demandez?
I believe it was about the Montfort Hospital. I'll try to unmute 104.7 again.
Refer to the care clinic or the hospital?
It's having a few technical difficulties. 104.7, can you unmute yourself, please, on the line?
Trouvé.
Okay, so I've unmuted everyone. Okay, go ahead. 104.7.
Moi, c'est Jérôme de Radio-Can. Je peux reposer la question que lui a posée. Là, grosso modo, ce qu'il a demandé, c'est avez-vous plus de détails sur la situation à l'hôpital Montfort? Donc, on parle vraiment de l'hôpital. Et comment est-ce que l'enquête procède? Donc, c'était sa question et non la mienne.
So
Sorry, go ahead, Jason.
Oh, I was just going to clarify, is this with regards, again, to echo Dr. Wilmore's comments, is it about the opening of the care clinic, or is this specific to an outbreak at Montfort Hospital?
It's about the outbreaking in the Montfort Hospital.
Okay, thank you.
Donc, je n'ai pas l'information sur moi maintenant, sur cet outbreak, mais il faudra juste suivre avec l'hôpital Montfort. Je n'ai pas vraiment l'information maintenant avec les détails.
Merci. Just because of technical difficulties, we'll proceed to go to 1310 at this time.
Hi there. My question is for Dr. Malakny. Can I get you to expand a little bit on the number of cases and how that compares to the total in terms of the rate of growth? And what is the rate of growth doing? Is it steadily increasing? Are you seeing somewhat of a slowing in the rate of growth in new cases? We're seeing a relatively low rate of growth at the provincial level. I'm wondering if you can comment on the rate of growth in COVID-19 cases here in Ottawa.
Sure, thank you. The numbers are fluctuating a little bit from day to day. The trend, obviously, we continue to have new cases. Today, we report over 30 new cases. Some of that may be due to the long weekend. It's difficult to know, where exactly we are in the curve, and I'm going to, pass it over to our modeling scientist, to Doug Manuel for his comments. I think at this point, similar to the comments we've provided in previous media availabilities, is the importance to continue our restrictions on activities, staying home, physical distancing, to pull this down, because I think we're going to really know we're on the downside when the numbers of cases are diminishing on a regular basis, day to day, over an extended time period, and then we'll know we're past the peak. The only other thing I would mention is that we continue to have new hospitalizations, new individuals in ICU, and those will continue to be useful indicators, although they sort of lag by a week or so what's happening in terms of new onset of cases. Dr. Manuel, did you want to add anything in terms of where we are from your perspective, looking at the numbers closely and the various modeling that you've been doing?
Not too much. I think, where we've been focusing on as well as the hospital, and the hospital is a window into the community. So, it reflects all the cases that are circulating in terms of a little bit of more severe, but not only those people that are being tested. And for hospitals, we're still seeing an increase. You can see it on the website as well, but 42 today. We're seeing a current doubling time. It's not on the website right now, of about 12 days to double the rate of number of people in hospital. And that started off around 3 or 4. So, when COVID starts in a new community, including Ontario and Ottawa, it's about doubling every 3 or 4 days, 2 to 4 days. So we're seeing some slowing of the doubling, and that same thing that's happening in the cases in the community as well. So it's slowing, and that's definitely a reflection of physical distancing. We can see that showing up. To have it stop, to plateau, the doubling time needs to go into negative numbers. So we're going to see some continued cases and continued spread in Ottawa. It's hard to say exactly when we're going to hit that plateau. It depends on the effectiveness of physical distancing. Based on the numbers that Dr. Etches presented last week, those numbers look good. If those numbers are true and we're actually reducing that much physical distancing, then we will get into those negative numbers in the future. Like, we will approach those. So those would be my comments, Brent.
Great, thank you.
Thank you. Is there a follow-up from 1310?
Yes, there is a follow-up. I'm just wondering, Dr. Malakny, you mentioned about loopholes, like, oh, I'm just having a beer in the driveway with some friends. I'm just visiting over the fence with my neighbor. How much of a concern are those sorts of little loopholes in terms of eroding some of the gains we've made around physical distancing and slowing the growth? I'm wondering if you could talk a little bit more about how concerned you are about people thinking that they're okay to do certain things when they really should just be staying home.
It's a great question, and it's really unprecedented what's being asked of all of us. For myself, we just relocated to Ottawa. We were hoping to have a big family get together for Easter to celebrate coming home, and we didn't do it, and we couldn't do it. And I think it's challenging for everyone. So people are finding, well, what if I just do this, or what if I just do that? And the challenge is that it kind of starts with that, and then a couple more people add on, and before you know it, you have a parking lot party or a backyard party, and I think we should take comfort that the effort that we've put into place so far is bearing fruit. I mean, as just Dr. Manuel was saying, we're seeing the doubling times increase, and so that should be good. But we shouldn't take it so far to begin to feel complacent. As Dr. Fossey in the States says, now is the time to push down the accelerator. We really want to, stop this as quickly as we can, because only then can we begin to have those conversations about or considerations about, well, how do we begin to relax the restrictions? So I say, we're having positive action, we're doing the right thing, and let's stay with it. We have to stay at home except for essential visits out into the community, and we all need to keep doing that.
Great. Over to CBC for the next question.
Hi, can you hear me? Hello?
Yeah, we can hear you.
Okay,
Go ahead.
It's Joanne Canello. My question is for either probably Dr. Malakny, but feel free to weigh in, anyone, on personal support workers. The city has now stopped personal support workers from working at more than one home. Why was this not done earlier? It's also not happening at the provincial level. So, I mean, how is this system being kept in place if it's being done sort of differently from one city to another? We know it's a problem. It was a suggestion even after SARS that personal support workers only work at one home, but how can they make a living? So I know that's a lot of questions, but that whole area is sort of new. People are looking at it. We have outbreaks in, I think, 15 home institutions in Ottawa. So obviously something people are worried about. And I wondered if you can sort of address that part of it for these workers who are under a lot of pressure, as you know.
Yeah, no, I'll start, and I'll ask Dr. Wilmore to also provide a perspective from his work at C4. I mean, I think you're right. We do have 15 institutions that are currently experiencing an outbreak, and I think that what we've witnessed over recent days and weeks is gradually adding additional protective mechanisms. So for example, the issue of asymptomatic transmission, the step there was to request that healthcare workers in these institutions, beyond those that are in outbreaks, that would be wearing masks at all time to take care of that particular vulnerability or reduce the risk of transmission due to that issue. You're quite right, I think, in terms of raising the concern about staff in long-term care facilities working in more than one. It's been flagged by the Ministry of Health repeatedly, urging people to reduce this. I would applaud the leadership of City of Ottawa for taking the step to say, well, at least in the homes that they operate, that they wouldn't do it. So from a public health perspective, we would clearly encourage these workers to only work in one place. It's complicated in terms of the employers that are involved, but certainly from a public health perspective, we would support them working in only one location. Dr. Wilmore, do you have anything else to add from a C4 perspective on this?
Certainly. So, the restrictions around where the personal support workers can go really is an operational consideration for us. Again, we align our operations around recommendations from public health. This essentially, our focus is going to be to ensure that we're able to support the institutions that are affected by the decision to not have folks working at multiple centers, which is important from a public health perspective. But these folks are doing really important work for these institutions. So it's incumbent upon us as a regional table to be able to look at any service disruptions that could ensue on the tail end of this decision, and make sure that we're working closely with everyone involved to make sure that at the end of the day, the care delivery continues to be maintained.
Great. Is there a follow-up question from CBC?
Yeah, there is. In a more general sense, you know, it was March 15th that Dr. Vera Etches first raised the alarm, said, don't send your kids to daycare. Do not go out for unessential reasons. So, you know, tomorrow we're on our 1 month anniversary of sort of the you know, serious physical distancing. We're looking at more of that. What do you say to people about dealing with their physical and mental health? Even things like, you know, I know Dr. Etches last week warned people not to drink too much, you know, to relieve stress. There's people baking, you know, you see photos of people baking on Twitter all the time. I mean, we've been home for a month. We're going to be home for many more weeks. Can you sort of address sort of the general health of society aside from COVID to physical distancing to staying at home?
Yeah, no, and I think you know, Dr. Etches has previously talked about that there are adverse impacts of doing what we're doing, and both from a social and mental health perspective, as well as an economic perspective. I think that where we are now currently in this outbreak, um, that we need to you know, develop various strategies, and I don't think there's one size fits all. I think, you know, for the individuals who are not a case, or not a close contact of a case, so just members of the general public, you know, getting outside for that walk is important, and you know, and so, you know, walking through the park, or walking down the path, or walking on the sidewalk is an important outlet. You know, there's all types of things on social media around, you know, this is an opportunity to do that hobby, or to do that thing that you've always wanted to learn or do. I think we can also leverage the social media and technology that we have today that we haven't. My family, I mean, you know, we celebrated someone's birthday party, and we had 20 people from across North America, you know, celebrate with this person, which was, you know, the next best thing. And I think those sorts of things, whether by telephone or tablet, or social media, to maintain our social connectedness, and particularly with some of our senior members of our families or our friends, because, you know, quite frankly, you know, in talking to elderly folks, they're worried. They're worried about going out. So it's an opportunity also to do something positive for somebody, which also makes us feel good. To you know, bring that person in, not physically, but socially, to connect with them and seeing how they're doing. Offer to do their groceries for them. Offer to do an errand if they need something, and they shouldn't go out to do it. So that's another way that we can contribute. There are
But, you know,
resources
people
on our. Can
Dr.
I just
Long,
finish? Sorry.
oh, I was just saying people are also reporting that they're gaining weight from being home because it's great to cook at home, but they're also like baking bread all the time.
Well, I mean, we have to sort of all things in moderation, right? But I was also mentioned that, you know, there are people though who will, you know, feel, you know, more down, or potentially distressed or anxious. There are resources on our Twitter feed and Facebook page that people can access. There are distress lines for people who, you know, need to talk to somebody. As of today's announcement, you know, and also Dr. Wilmore's, about individuals who are in unsafe situations, being at home, in terms of how they can reach out and get assistance. So I think there's a menu of various types of things that we can do. I was talking to someone today, and their family started doing high intensity interval training at home. I was also trying to keep the kids active. So I think we all need strategies for our own particular situation, and it's also an opportunity to help others as well.
Great. Let's go over now to CTV
Thank
for
you.
the next question. So again, that was over to CTV.
Oh, can you hear me?
Yes, we can.
Perfect, thank you. This is a question for Dr. Malakny, or sorry, Dr. Wilmore. You had said there is about 7,400 people tested so far at the Brewer Assessment Center, which works out to 250 a day. Is the reason you're not seeing more patients come through there because there are fewer people with COVID-19 in Ottawa, or is it because people are of the testing criteria? Is it a whole bunch of things? Any idea why it seems you're not seeing as many people there that some people think you should be?
So we, again, we work very closely with public health in the province in terms of who we are swabbing. It's a net that is cast, and the decisions around who gets swabbed really are guided by our public health colleagues. There are barriers to getting to the Brewer Assessment Center in some vulnerable populations, such as long-term care and retirement homes. So we're actually working this week, hoping to go live in the next few days to increase our outreach model using community paramedicines to provide swabbing in long-term care facilities and retirement homes. And we're actually going to leverage our family doctors in the region to be able to assist in this work, and also to provide home care assessments for these vulnerable populations. Certainly, criteria for swabbing have become more inclusive, and we will be adjusting to increase the swabbing to meet the demand, whatever the demand is.
Great. Is there a follow-up question from CTV?
Yes, another question for Dr. Wilmore. The Saskatchewan Health Authority says it is working towards having all of its healthcare workers be tested for a high temperature before and after every shift. Is this something the Ottawa Hospital is looking at doing to make sure that their staff are healthy as they arrive for work for each shift?
So it's certainly been discussed. We have a screening criteria by which healthcare workers self-screen prior to coming to hospital, and we have a centralized screening process where those questions are asked. The actual testing of healthcare workers coming into hospital has not gone live.
Thank you.
Thank you. Maintenant, on va entendre le droit maintenant. Le droit.
Oui, je ne sais pas si la question est plus pour Dr. Malakny ou Dr. Wilmore, mais je me demandais comment on se situe en ce moment au niveau de l'approvisionnement en équipement de protection, que ce soit les masques, les visières, les gants. Est-ce que ça se passe toujours bien dans nos hôpitaux?
So perhaps we'll start with Dr. Wilmore, and it was a question on what's the current situation around PPE.
Donc, nous avons maintenant suffisant équipement protectif pour nos travailleurs, mais nous sommes toujours en train de trouver des autres façons de protéger le niveau d'équipement que nous avons. Donc, nous avons changé la manière d'utiliser l'équipement pour nous donner plus de longévité à l'équipement. Et aussi, nous sommes toujours en train de développer des systèmes où on peut même reprocesser ou trouver une source différente pour le même équipement. Donc, c'est toujours une chose qu'on est en train de penser, d'être proactif pour nous assurer que nous n'aurons pas une situation où nous n'avons pas. Mais au moment, ça va, mais il faut être vraiment attent et aussi utiliser l'équipement d'une façon basée sur la science. Parce que beaucoup de temps, le réflexe, c'est de mettre tout ensemble ce qu'on a, mais dans la situation globale, avec la difficulté de trouver cet équipement, c'est très important d'utiliser juste ça que c'est nécessaire pour le contact avec le patient et en même temps nous assurer que nous avons suffisant équipement pour donner pour toute la région.
Merci. Est-ce qu'on a un suivi maintenant de le droit?
Oui, est-ce qu'il y a une possibilité que ces mesures-là pour s'assurer qu'on prolonge la durée de notre stock de matériel de protection puisse avoir un impact sur la transmission du virus chez des employés des différents hôpitaux, comme on a vu à Montfort. Il y a des membres du personnel qui ont contracté le virus. Est-ce que ça peut avoir un lien finalement avec le fait qu'on essaie de ne pas porter de masque à toute occasion finalement?
C'est une très bonne question et vraiment, c'est un risque. Donc, chaque fois qu'on change la manière de faire n'importe quoi dans un centre hospitalier, il faut vraiment penser des effets secondaires qui peuvent arriver à cause. Donc, nous, dans la planification pour les changes qu'on a eu besoin de faire pour la limitation de cet équipement, nous avons travaillé avec nos partenaires dans la santé publique, aussi avec Infection Prevention and Control, donc les experts pour IPAC, pour faire des protocoles qui sont basés sur la science et qui sont consistants avec les recommandations de la province. Donc, c'est tout à base de direction ministérielle et on fait l'implémentation avec soin pour nous assurer que vraiment ça marche dans notre environnement.
Merci. Let's go over to Orlean Starr for the next question.
Testing. So I was just hoping to get a clarification on who is getting tested in Ottawa right now. When do you envision that being ramped up, and how do you envision it being ramped up?
So that would be a question for Dr. Malakny.
Sure, I can start. So one of the things the ministry did in the past week was to expand the list of priority groups to be tested, and so there was more information, for example, on members of remote, isolated, rural, and indigenous communities, as Dr. Wilmore mentioned, more sort of testing scenarios that should be pursued for long-term care and retirement homes, and so those priority groups have been expanded. And over recent weeks, the ministry has fine-tuned those priority groups over time, and so one would presume that as this outbreak advances, that there will be further fine-tuning by the ministry. Dr. Wilmore, did you want to add anything to that?
Sure. So our Brewer Arena Assessment Center is really where we want to direct the bulk of the patients require swabbing who are able to come to the arena. The challenge lies in vulnerable populations that may or may not be ambulatory, that may require special care, which would make such a visit difficult. So we're really trying to look at those barriers, and that's an example of why we're rolling out. We've rolled out our community paramedicine model, and we're going to amplify it with family doctors in our community to be able to increase the swabbing that happens on site for those patients that do not require treatment in hospital or transfer to hospital, and at the same time being able to provide them with an access to primary care.
Sorry, go ahead with your follow-up for Orlean.
As a follow-up on the assessment center, it was my impression that the assessment center is supposed to be processing vulnerable populations, and that OPH is still recommending that people who are, let's say, not high risk, who are experiencing some symptoms, should still stay at home with those symptoms unless they progress. Is that correct?
Well, so the assessment center is for folks that meet the swabbing criteria. So the Brewer site and the number that I gave in terms of the number of swabs, those aren't the only swabs that are happening in the region. So for patients not requiring medical treatment, but who need to be tested for COVID, that's what the Brewer assessment site is for. The care clinics that we've opened on the east and west end, those are for folks that require a medical assessment. They're feeling unwell, they're having escalating symptoms, and these facilities will also test. you know, and adding to that, the outreach model for those folks that can't even present to the care clinics is essentially going to bolster that, and we're going to continue working at trying to identify any groups that are you know, having difficulty accessing this modality, and we will ramp up our activities as necessary to make sure that we leave no one out of the loop.
Sorry, so that sounds like anyone with symptoms can go to the East or West COVID center. Is that correct?
That's right. And actually, the East or West care clinics are not limited to people meeting criteria from you know, from the perspective of COVID swabbing. So it's really for anybody who has a fever and respiratory symptoms and feels unwell. We heard loud and clear from our many of our family doctors in the region. You know, there's some clinics that, because of the layout of the clinic and their ability to handle the volume of patients with febrile respiratory illness, they were able to continue operations, but many clinics actually weren't able to. So a lot of docs have switched to virtual care models, but unfortunately, the final common pathway of a virtual care model for folks requiring a clinical assessment is to go to the emergency department. So that's why we open the care clinics, and we do encourage patients with symptoms who are thinking, geez, you know, I'm starting to feel a bit worse. You know, I'd want to be assessed, you know, by a family doctor to present to those clinics, and to remind patients that if they're having a medical emergency, chest pain, severe shortness of breath, if they're feeling very dizzy or unwell, that they should still present to the emergency department, as we do have capacity to see them and would like to see them.
Thank you. Let's go over to the Ottawa Citizen for the next question.
Hi, can you hear me? Can you hear me?
Yes, we have you here. Go ahead.
Okay, great, thank you. I understand that the local modeling has been updated, so this might be a question for Doug Manuel. Everything seems to point to a peak in April if we maintain 70% social distancing. Is that correct? And if so, can you explain how the parameters of that work and what that means in the long run?
Sorry, on our models, I'm trying to. I can't keep up to date on all the peaks actually, but
yeah, this was on the 613.ca, which suggests a peak in April if we maintain 70% social distancing.
Yeah,
does that
I
sound
think,
right? And what does that mean?
Peak in April. Well, we're peaking according to those models. Like we're peaking right now. I think that I'm feeling a little bit uncertain about exactly when that date's going to happen. In part because I don't know the level of social distancing. If we're at 70%, that's the kind of tipping point. Like 60, 70%, what I would call effective social distancing. And you guys are I look to you guys for guidance about how to communicate this. I think of you guys as the expert, and we're getting lots of questions about how to communicate it. And if I could, I'd take a minute just to explain technically, and then you guys can say, well, you should have said this, or you can do it. But what happens, if an infected person comes in contact with an uninfected person, there's a probability that uninfected person is going to get an infection between 0 and 1. And that's beta. Physical distancing reduces that. So if it was a 50% chance, that beta was 0.5, and 50% physical distancing, we reduce that from 0.5 to 0.25. So it's not so much like, what if I don't have a beer with my neighbor? How much is that going to reduce, physical distancing? What we do is we just calculate the amount that we separate people. And so in those formulas, when you get around 60 or 7%, we start getting that beta, those numbers down, so that that magic R naught that you hear about below 1. And then we'll see the cases starting to decrease. So, 60 to 7%, again, we haven't put up on our website yet, but effective social distancing, we can calculate that, but we're not sure how to interpret it. So we haven't published those yet. And they're also lagged. Like it would be what we're seeing last week, not what we're seeing a few weeks from now. But I could say, if we get up to that 60, 70% for a few weeks, 3 weeks, then we're going to be seeing the peak sort of level off. And there's going to be a delay in terms of what we see in terms of hospitalizations as well. So it's not only 3 weeks till we see a reduction in new cases, and then a week later for reduction in hospitalizations. So that's a bit of detail into the numbers, and maybe a bit of hand waving. Like I'm a little bit uncomfortable to be sort of quoted on those specific numbers, but that's the concepts at least to help you.
Great. And do we have a follow-up question as well from Ottawa Citizen?
Yes, it's a question about the survey, which I believe Dr. Maloney said right off the top, 84% said they were practicing social distancing. Is that correct? So what does that tell us about those who are not? And do you suspect that there are a large number that are not declaring that they are engaging in that kind of behavior?
Yeah, no, I mean, there's always, when people respond to a survey and self-report their behaviors, there's a phenomena where people will tend to cast themselves in the best light. And that's normal for any survey, but I think as the initial survey did to basically take the temperature, so to speak, of where we at, what was really positive out of this is that the vast majority were saying we think we're taking the right steps. And so part of our job, our mutual job, is to continue to communicate, the importance of continuing it and the types of things that you should be doing and not doing. And I think that for anything like this, there will be a certain proportion who, for whatever reason, are not able to fully participate. But key is that the majority of us are, and that's what's going to drive this down.
Thank you. Maintenant, Radio-Canada.
Oui, bonjour. Ma question est concernant, en fait, l'éclosion à l'hôpital Montfort, entre autres. On apprenait hier là, que 40% des patients canadiens qui étaient atteints d'un AVC ne voulaient pas se déplacer dans l'urgence parce qu'ils avaient peur. Je veux savoir comment est-ce qu'on peut assurer à la population ontavienne que, premièrement, les hôpitaux sont un milieu de travail sécuritaire pour le personnel et un milieu sécuritaire également pour les gens qui veulent se déplacer, les patients dans les urgences.
Donc,
So that was a question for Dr. Wilmore.
Donc, je n'ai pas les détails pour Hôpital Montfort. Il faut vraiment parler avec l'Hôpital Montfort pour les détails de cette situation. Mais je peux parler de la région. Nous sommes en train de travailler avec la santé publique, avec nos experts dans la prévention d'infection pour nous assurer que l'environnement hospitalier, c'est un endroit qui est safe. Je m'excuse, mon français. Mais vraiment, on continue à faire ça. Nous avons des protocoles qui nous sommes toujours en train de réévaluer et nous savons que nous avons des mécanismes effectifs pour prévenir la transmission du COVID et aussi des autres maladies. Chaque fois qu'on a une situation que nous avons un outbreak, nous travaillons avec Santé publique pour faire l'investigation et trouver tous les contacts pour trouver la cause. Et quand on trouve cette cause, nous pouvons changer le système pour nous assurer que ça ne se répète pas dans d'autres institutions. Donc, sans les détails de exactement qu'est-ce qui se passe au Montfort maintenant, il faut vraiment laisser l'investigation continuer et il peut parler avec détail quand c'est complet.
Merci. Un suivi maintenant de Radio-Canada.
J'aimerais peut-être qu'on parle un peu de la situation des centres pour personnes âgées. Là. Joanne a posé une question à ce propos-là en anglais. Quelles mesures on prend à Ottawa pour assurer la sécurité? Est-ce qu'on les teste tous, etc.?
Pour qui, pardon, je n'ai pas entendu.
Les centres pour personnes âgées à Ottawa.
Donc, nous sommes en train de finaliser un système. Nous avons déjà des paramétriques de communauté qui sont en train de faire des tests dans les institutions de long-term care. Mais nous sommes aussi en train de faire un système où le médecin de famille dans la région peut aller dans cette institution pour aider le travail de paramédic. Nous voulons vraiment augmenter le numéro de tests et aussi les soins qu'on peut donner pour à ces institutions. Nous savons que l'habilité des patients à trouver contact avec médecin de famille, c'est un peu compliqué maintenant. Et c'est pour ça qu'on est en train de pas seulement faire les cliniques de soins dans l'Est et l'Ouest d'Ottawa, mais aussi aller chez eux pour lui amener à la même chose qu'on est en train de donner dans la clinique et à l'hôpital. Mais toujours, si quelqu'un trouve qu'ils n'ont pas un recours, ils ont besoin de soins, ils peuvent toujours aller à l'hôpital ou à une clinique de soins.
Merci. Maintenant, c'est TFO. TFO pour les prochaines questions.
Oui, bonjour. Ma question concerne donc la situation à l'hôpital Montfort. Je comprends que vous n'avez pas de détails, mais est-ce qu'il y a d'autres hôpitaux comme ça dans la région d'Ottawa qui ont eu des éclosions de Covid depuis le début de la pandémie?
C'est une question pour Dr. Malakny. In English, are there other hospitals across the area? Maybe we could speak generally to outbreak, just the general profile of the outbreaks.
Right. Yeah. No, thank you. And my apologies for responding in English. Yeah. So on our website, we have information on the current status of outbreaks in institutions. So when it's in a hospital, I think as Dr. Wilmore was describing moments ago, we work very closely with the hospital IPAC team to review and investigate those. And they take the lead in terms of what happens within the hospital. We take the lead in terms of follow-up within the community, and we keep in close communication to coordinate those activities. It's a little bit different for the long-term care homes, where we take a much more active role from an IPAC perspective. And provide more detailed guidance in terms of helping them control their outbreak. With the complexities of COVID-19, we're very happy that Dr. Wilmore and the C4 group are available to help deal with some of the more complex operational issues around staffing and access to PPE. So, and again, that's very much coordinated and organized between public health and the healthcare system.
Merci. Est-ce qu'il y a un suivi des TFO?
Oui, un suivi juste pour savoir, le fait que des employés comme ça de première ligne soient touchés, est-ce que ça entraîne un risque qu'on manque de personnel à cause du fait qu'il faut les mettre en quarantaine? Est-ce qu'il y a un risque qui est associé à ça?
So is there a risk to frontline workers being placed in quarantine for our health system?
Oui, absolument. Si nous avons une situation où beaucoup de travailleurs dans un centre hospitalier ne peuvent pas travailler pour raison de quarantaine, c'est une déplétion à des gens qui peuvent travailler. Donc, c'est une chose que nous sommes en train de formaliser un système pour nous assurer que nous pouvons aider les institutions qui ont ces problèmes. Parce qu'il faut avoir un niveau de personnel disponible pour pouvoir continuer les opérations d'une institution. Et c'est très important de planifier autour de ça parce que je pense que nous pouvons nous allons voir des situations où ça sera très difficile pour des institutions pour continuer les opérations et comme une région, nous allons aider ces institutions pour augmenter le numéro de personnes qui sont disponibles. So, and I'll just repeat it in English. I had a request from our media folks to just repeat them in English. So certainly, from a staffing perspective, the need for self-isolation or quarantine of healthcare workers themselves is absolutely a risk to the healthcare system. And it's one that we're actively mitigating by creating a regional labor pool whereby we can backfill those institutions that are facing staffing shortages as a result. So again, this is part of the landscape of knowing your risks and being able to actively mitigate around them.
Merci. TVA maintenant avec les questions.
Est-ce que vous m'entendez?
Oui.
Oui, bon, vous avez déjà répondu à mes questions, mais j'ai juste une petite question. Peut-être vous l'avez précisé plus tôt, mais bon, on a 2 nouveaux établissements qui sont touchés par des éclosions. Juste m'assurer, c'est lesquels ces 2 nouveaux établissements-là?
Est-ce qu'on peut répéter la question, s'il vous plaît? Il y avait des bruits juste dans le fond.
Est-ce que vous m'entendez mieux comme ça?
Oui.
Oui, OK. Ce que je voulais savoir, c'est qu'il y a 2 nouveaux établissements qui sont touchés par des éclosions. Je veux juste savoir c'est lesquels ces 2 nouveaux établissements-là aujourd'hui?
So which were the 2 new institutions to have an outbreak is the question, Dr. Malakny?
Yeah, no, thank you. No, I don't have that information right in front of me, but we could get that to you after the call.
Thank you.
Merci. Et un suivi?
Non, ça va, merci.
Merci. Your community voice is up next. So the floor is to your community voice.
Yes. I missed the beginning, so I apologize if you've already answered this question, but at the start of these daily pressures, we used to get the numbers around what the community transmission is, so not related to travel. Has that been given out earlier? And I apologize if you did.
Yes, we would have reported on the number of new cases, and by memory, which I'm worried about just doing that. So we are at currently, as of 4 p.m. yesterday, 619 lab confirmed. That's 33 new confirmed cases since yesterday. And I would say that over time, the proportion that are travel related, as you would anticipate, have been diminishing.
So
Thank
we
you.
don't know what the percentage is at this point. It was as low as about, I think, 12 or 13% community transmission at the beginning of this. Would that be much higher? Or?
I don't have a number right in front of me, but certainly many of the cases would not have a clearly identifiable contact with a known case. So by definition, that would be a community transmission. So yes.
So just as a note for everyone on the line, that on our website at ottawapublichealth.ca, there's a section with statistics on coronavirus. If you download the full report, that information is broken down on a daily basis prior to these media conferences. So that information is also available in writing if you would like to check that out. We'll give the floor over to Ottawa Sun now.
Thanks so much. I wanted to ask, at what point, if ever, will we be able to expand testing criteria here in Ottawa to include everyone with COVID-19 symptoms? We saw Alberta today announce that that is exactly what they will be doing. And I'm wondering, what is stopping us from doing that right now?
So I'll take the initial stab at that. I mean, there's a few answers to this. So first is availability of laboratory capacity, reagents, and swabs. So there's that sort of technical sort of capacity piece, and as you've heard in recent weeks, there's been efforts to increase capacity of all of those. The other piece, though, is at this point in the outbreak, do we need to be testing everybody for control? And I know the Chief Medical Officer of Health of Ontario sometime last week responded to this question, and from his perspective, he would say no. I was looking at South Korea's approach earlier today, and actually their criteria are not that dissimilar from ours. And so, I mean, the key that we're doing in terms of a strategy at the moment is with physical distancing to reduce that community transmission. downwards, and of course to do case and contact management of the cases that we are aware of, particularly in high-risk groups, because there's much broader implications of a positive case. So I think in terms of this part of the outbreak where we're trying to bend or plank the curve and get on the downward side, we don't actually have to test every single person to be able to get this under control. In terms of, I think the future, and I think there's going to be further conversations about this, is when we're down to very few cases, and we're starting to look to relax. What will our testing strategy need to be? And I don't have an answer for you now, but I would predict it could look a little different because where we are in managing COVID-19 will be a different place. But at this point, with physical distancing, with the restrictions on activities and settings that are open, with the expansion that has occurred in recent weeks with the assessment center and the clinical care centers, that will continue to ramp up, and certainly we are ramping up the testing that's occurring in high-risk vulnerable populations, which are a particular concern. But I'm not sure we'll actually need to get to a point where we have to test every symptomatic person in Ottawa to get this under control at this point.
Thank you. Is there a follow-up question from Ottawa Sun?
Yeah, I'm just trying to understand, I guess, why you wouldn't want, like, why not test every symptomatic person besides, as you said, the constraints on the actual resources. When you say there might not be a need to test every symptomatic person, doesn't collecting that data, doesn't knowing who exactly is a confirmed case offer benefits?
I mean, hypothetically, yes. Pragmatically, knowing the limitations, I think I have confidence that we can get this under control, and we are getting it under control. And the doubling times are increasing, as Dr. Manuel said, without having to test every single person with cold symptoms. Because the other thing that goes from a control perspective that goes through my mind is that, for every case that has symptoms, there's people out there who have no symptoms. And so we don't want to lose sight of those and what we need to do to keep them, because they don't know they're infected, from transmitting to others. And so that's why we've needed, due to the characteristics of this virus, quite broad restrictive actions to be able to positively, influence and stop this outbreak.
So thank you very much. This is all the time that we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you very much. Merci.